Bienvenidos.
Thank you. You've made the first step to getting better, so I thank you guys for coming out. I know it's raining. Tawil Physical Therapy was founded by Dr. Michelle Tawil about 8 years ago, right? Somewhere around there?
4.
4. Okay. 4. They've done really well in 4 years. My name's Stephen Blayney, physical therapist. I am independent contractor, so what I do is come in times like this when Michelle had her baby. She has a 4-month-old at home. I come in and I take care of clinics. The reason why actually Tawil Physical Therapy is the preferred therapist for North Bergen High School and very well known in the community to giving quality care. And that's what's important to us. We give one-on-one care. Laz is our office manager. She makes things run. Any questions about the insurances or those sort of things, she can handle that. Jody in the back is one of our 3 exercise specialists. It's very important that when you're doing an exercise here, you're one-on-one. A lot of places, unfortunately, have gotten caught up in the go on the bike or go in the back and do the exercises. We don't do that here. We do quality care. That's why in only 4 years, in my mind I'm saying 8 because she's grown so much and we're so popular and we have so many patients that love us because of that care. So as a physical therapist that's hands-on, we do a lot of hands-on approach and those sort of things. So the reason why I'm in New Jersey is because I was the New Jersey Net Soft Tissue Specialist for a year back in 2000. What's up with the hat? Cavs. Should have the New York Nets on. You don't like the Nets? No, Cavs is cool. But that's what I do is I'm a specialist. I treat a lot of professional athletes. I get really good results and outcomes with what we do. A lot of internal referrals. A lot of people bring their mother, their daughter, everybody comes in for the family. So you're in the right spot to getting better. So you've already made that first step. What we're going to do today is a lot of education. My Spanish isn't good enough to really do too much.
Your Spanish is pretty good.
It's pretty
Don't
good.
underestimate yourself. Yeah.
Sonoterapia, boca arriba, boca abajo. So I can do a little bit, but let me know if you have any questions. Just raise your hand, including you if you have any questions. Right. So today is a lot of education in the beginning. The reason why we have this test is I want you to realize what you have, and you've already said to me, down the leg. That's sciatica, right? The sciatica means the nerve. It's sciatica. The sciatic nerve is the largest nerve in the body. So it derives and starts from L2, L3, and L4, and comes together, goes down through the culo. Can I say that? All right. What is it?
La nalga.
La nalga. I got all kinds of words.
Yeah.
You write these down.
Some of them
I'm
are
always
bad.
saying
Some of them
culo.
are bad.
Depends on the country. Depends on the
El
country.
glúteo.
Gluteo. And a gluteo,
more.
and all the way. Sometimes, I believe you said in the front. That's a little higher. We're going to talk about that.
¿A dónde queda la
That could be from.
Yo tengo nervio pinchado.
La
Entonces
cadera.
esta pierna
That actually could
Eso
be.
es lo que, eso es lo que está hablando, que el nervio ciático viene de la espalda de aquí abajo y es un nervio que va y
When
bajando.
it goes to the front, that could be more hip related. I'm going to.
Sí, el dolor te viene por adelante o por atrás.
Adentro. Ajá, adentro.
So we'll get into the details.
Después era en esta pierna la mata, entonces cuando tuve una recaída, pues me dio en esta también.
Sí,
So there could be not just one thing. So
sí.
in
Él
medicine,
va a explicar todo eso.
and especially Western medicine versus Eastern medicine, we put everything into a box. We have diagnoses through X-rays, MRI, and CAT scans. So that helps us look at something. But you got to treat the individual, and that's what I'm going to be doing today. You can educate the person and say, this is what I may have, and it spits out a whole bunch of exercise and those sort of things. But what I'm looking at you, I'm just thinking at your hip. So I'm going to be looking at your hip flexor in the front. And we're going to educate the bones and the nerves and the discs and those sort of things in a little bit. But the point is, come on in, the point is, you have to treat the individual. Okay, and that's what we do here, and that's why Dr. Toole is so successful, that's why I'm so successful. So working with the Jersey Nets was a great thing. I still have professional athletes I work with, and I get those results because we do a lot of hands-on. So I'm going to educate you. When certain things point out and you say, that's me, I'm sure you're going to have a special attention to that. Maybe write little notes for yourself. And then we're going to break a little bit. I might be able to treat a few people. I'm definitely going to treat one person during just to show you how I do things. So the sciatica, going back to that, the reason why it's so important is it's the biggest nerve in the body. Causes a lot of pain. Okay, it has a low threshold for pain, and it's in the butt, back here, through that. And we sit a lot in this environment. We're sitting now. Now, when you sit like that, the hip flexor in the front gets short, and it compresses the spine. So let's go to a little anatomy.
I have a spine too if you want.
That'd be great. Thank you. what does this look like? Look at a dog. See little Scotty dogs?
Looks like a bone.
Looks like a dog. Aye! Bingo! It's a bone! Now, I said sciatica is L2, 3, 4, 5 nerve roots. The most common disc issue, right? Most people have L4, L5, right? Below that is a sacrum. That's not a good representation of a sacrum. I'm not a good... Here's good. It's not bad, right? That's the sacrum. Okay, right here is the sacrum. And off of here is the ilium. So when we talk about SI joint, we talk about the sacrum, which is here, it's a fused bone, and the ilium, which is the hip. And that's why we look at everything. We look at the foot, we look at the leg, we look at the hip. And if you go to the front, the hip flexor that I'm speaking of runs through here. I am huge on this muscle because it attaches, this is L5, L4, L3, and L2. It attaches to these vertebrae like this. So imagine this muscle pulling this way, and it's a big muscle. There's two of them actually. It creates compression. So if I turn this to the side, this is a nice space. Has anybody grown over the years? Not you. Anybody grown in the last 5 years? We're getting shorter, right? You ever notice she gets shorter?
Yeah.
She said she's getting shorter.
This way.
Después de la cirugía yo he bajado como 4 centímetros.
So that creates compression.
Aquí no hay. Aquí no hay.
That's another thing we talk about, nutrition and
Ya
hormones.
que
That could be
crezcamos
hormones. We
ya.
can talk about that
Hasta los
later.
25 se crece.
Sí, porque why were you asking if anybody's grown? Because she's saying that we only grow up to 25.
Right.
Yeah.
So minus
So tú
this
estás
guy.
correcto. Él dijo que tú estás correcto.
Well, you're growing, I hope. So as you're going this way, we're all going this way. The reason is because of compression. Now in through here is the disc. We know what the disc is, right? You guys know what that is? If you take that jelly donut back there, that's a jelly donut, right? And this is all the jelly. And
So
this is the donut.
estos son los discos. Y eso es lo que tiene los discos, ¿sabes? El movimiento.
And there's rings in there. And this is why it's so important that compression creates pain. You have stenosis pain, which is basically the narrowing of this area. But then you also have the herniation, which means the jelly comes out. Now if I were to put a line through here, can anybody guess what might be running down from the back of our head down through here?
El gel dice el que se sale.
Sí, cuando el jelly se sale,
You can see the jelly over here too. There's actually a nice red dot right there, see?
Cuando se sale la gel
So if I turn it this
se
way-
seca.
what's the jelly when it comes out?
That's the disc, it's a
that's the disc.
herniation.
Eso es un disco herniado, cuando el
And you have-
jelly se sale entre los discos.
Eso tengo yo
Disc.
dos.
So it's like a
Dos
disc.
abajo.
And what causes it to get out?
So basically, great question. Now, what if I were to make this vertebrae go this way? If I had to bend forward, and this kind of stayed home, and this is locked up, you have an SI joint problem anyways. If I were to bend forward, this would go this way, and that would go that way. Make sense? So now we're all sitting, we're all in flexion. Unfortunately, that's the way life is right now. If we go back a couple hundred years, we weren't like that. We were in trees, we were hunting, we were doing things. Now we sit, we have this environment, unfortunately, and that's what happens. So over the years, it creates a pressure, and the jelly comes out. If the jelly comes out, it's going to hit this area in the blue. This area in the blue is our spinal cord, right? It comes all the way down. If you look at the spinal cord, it has these little legs that come out. So inside there, if you can appreciate it, there's the spinal cord. That's very important. It's protected by a lot of things. That's important. That's what happens when people have football incidents with the spinal cord and they get, unfortunately, they get paralyzed. That comes through here because of the nerves that come out. So these nerves end up getting pinched. Here's a good nerve right there. This is L5. That's L4, sorry. So when you go forward, it pushes the jelly out. And that's called disc. There's different levels of discs. You can have a sequestered, which is the most horrible thing. That's completely out. A herniation, and there's different levels of that. And that's where the MRI comes in. We can kind of see where you're at and create a prognosis for how long you might need treatment. So disc is this way, bend forward, comes back out there, hits the nerve. Now, why would hitting the nerve create pain in your foot? It's kind of weird, right? You don't have an actual foot issue. Okay, the reason is this nerve has fibers that go up and fibers that go down to the foot. All right, there's the foot. So the reason why you're feeling that pain in the foot is because it's been altered through here. So your brain gets confused. It says, why is this foot no longer feeling like a normal foot? It has tinglies, it has different things. Because it's been clamped here. It can also be clamped in the butt. It can also be clamped in the hamstring. So if I look at a bike, in a bike brake, thanks. You have a bike? Ride it? You ever ride a bike?
You know,
I'm gonna get you a bike. The brake's here, right? So if I hit the brake, it creates a compression to pull that up this way. When it pulls up, if you've ever seen it, it clamps on the tire. So the tire is the foot, and up here is the spine. So you can have, as soon as you hit that, it has a little, it slides through, right? So it has to slide through. The nerve is the same way. It has a sheath and has everything to slide through. So now you have initial compression maybe through here. The initial thing could be through here because we're sitting so much. Or the initial could be anywhere else because you hit your foot or those sort of things. It doesn't really matter. It could be 80% here, 10% here, 10% here. We got to clean that out. All right? The way we do that is a lot of ways. Me, number one, is to use the hip flexor and release the hip flexor because of that compression through there. So that's number one I do. Number two might be doing extension exercises versus flexion exercises. So if I create this lever going this way, you can push it back where it's supposed to be. That's called McKenzie exercises. Time and place for that, we'll figure out individual person. That's the disc in a nutshell, basically. Herniated nucleus propulsa. Herniation, those sort of things. Now we have stenosis, we kind of touched on that. When we get shorter, this comes together this way. Now in here we also have 3 joints in the spine that become degenerated or broken down. Could be something that you're born with, genetic. Unfortunately, stenosis is very much genetic, so if your mother had it or those sort of things, you probably would have it. And that creates degeneration through these 3 joints. That typically comes on, let's turn this back over. So if you have an issue with bending or lifting, that's typically a disc issue. If you have an issue with standing or walking for a while, and then all of a sudden you go on to grab that grocery cart, and you bend forward, that's usually stenosis. Now, I'm not saying you can just have one or the other. You may have a combination of all 3, and that's where the clinical part comes in. That's where my expertise comes in and say, you're 80% disc, let's clean that up, but then back up, let's look at the stenosis, let's look at the SI joint, let's look at your hamstrings, and that's where the whole picture comes in. Now, if you're sitting and you have pain, that creates compression into your sacrum, right? SI joint is sacrum iliac. Sacrum's in here, the ilium's through here. If you're sitting and have pain, that's typically SI joint. So those are the 3 major diagnoses that we have. So the sciatic nerve is the largest nerve in the body. All right, it travels from the lower back to the leg. We talked about that, the bike brake.
Eso tú sabes que la ciática, explico 3 cosas. La ciática es el nervio que viene de aquí atrás y baja hasta el pie, que causa dolor.
And it can create pain.
Y puede causar mucho dolor.
Which is the body's way to tell you something's wrong. It's protecting it. It's actually a good thing. It's survival of the fittest. When you're in the woods and you have an issue, it's going to put pain there to tell you, let's protect this, and then you're going to compensate. There's a lot of compensation. So if you've had pain for a long time, you're going to have ankle problems, hamstring problems, knee problems, neck problems. Yes?
How do you get the pinched nerve?
The pinch, typically there's a percentage. I would say 80% of that is disc, and that's because of too much flexion. Tight hip flexors, weak abdominals, in that order. So when I treat somebody, I usually will see how they do with flexion versus extension. If they do well with extension, we know that's definitely pretty much a classic disc impingement, or disc issue. The MRI helps too, because that streamlines my treatment. It's always nice to have that. It could be from hip flexor compression, it could be from abdominal issues. I troubleshoot a lot of things nutritionally, hormonally. You can't just do one thing and say it's it. That's sort of what I'm thinking. Disc from too much flexion, too much lifting, too much bending from the pushing it back. Degeneration, that's more stenosis, that's more for older population, 50 and older typically. And it could be from SI joint as well, from the pelvis being off. So if you ever looked at somebody walking, it could be off like this. So if they're off like this, it's going to be closed on this side. So if you look at the different dimension, let's go to, there's also facet issues I haven't talked about yet. So it's a good question. So we have the herniation from going forward too much, that disc pushing back. You have the SI joint, which is innominance, we call it this way. So if the body does everything it can to stay on the horizon. So it all starts with our eyes. The second part is our sacrum, and the third part is our talus. So your body will do anything it can to stay on the horizon. It doesn't care what happens through here. It wants to make sure you're upright. If you get dizzy on a boat, that's why, because it's confused, your brain's confused, it's trying to stay on the horizon. So going back to the SI joint issues, you have a deviation through here. You're going to collapse to one side. These are the three joints through here. These are facet joints. There's 1, 2, 3. Typically the two in the back cause the issue. So if I have a nerve through here and I'm going to pinch this way over time, it's going to wear that joint out. It's called facet joint. So what I do, release the hip flexors again, create decompression. I'll put you on this side. I'll put you in a side lying positional release to open this up, bring this back. I'll work on the QL muscles, the hip muscles, and get it released. That's basically how disc issues happen. Trauma could be trauma, direct trauma, that's rare, and hereditary just over time. That answer your question? Mm-hmm. So, pain is just your body telling you, stop doing what you're doing, go see the doctor, go come see me. The tingling is, okay, your brain doesn't get the signal, it doesn't, it's pinched. So those are the things you'll see, pain and tingling. Alright, so you got the first part. So it might be best to just make sure you have the answer key good. I want to give you guys all hundreds and A+. So you write these in, it helps you just sort of remember and educate you, which is important. So the largest nerve in the body, it travels from the lower back to the leg, caused by a problem in the back. How do you do in school? You do? That's the way to do it. So sciatic nerve is the largest nerve in the body. It actually splits to different segments all the way down to the foot a few times. Pain running down the back of the leg caused by a problem in the back. Pain and tingling. I don't want to hyper-focus too much on that because that's, as long as you're educating it's in your head, that's fine.
Yeah.
The main idea is, if someone's not paying attention, I think I got you guys' attention. So we're fine. All right, now you have this issue, and you come to see me. Nowadays, you can come straight to a physical therapist. It's called direct access. I can see you. Typically, you want to see your doctor. I'm really good at troubleshooting. If someone comes straight to me and I think there's something going on, I'll refer you to a doctor. I'll refer you to a chiropractor if I think you need an adjustment. I'll refer you to an acupuncturist if there's a systemic problem. I'll refer you to your nutritionist or your primary care if I think there's issues. That's what physical therapy is going towards as far as the career, which is good. So once you come to see your doctor, maybe they'll order x-rays just to rule out some crazy stuff, cancer, those sort of things. Maybe they'll order an MRI if there's referred pain. Maybe they'll order a CAT scan if the stenosis is pretty severe. Whatever that is, that helps me. When you come to me, now I have that, I have information. So what I'll do is I'll do my clinical examination, and I'll try to produce, is it producible? Can I recreate your pain? Like, if you're saying it's down the leg, I'll put you in a position to make that pain happen. Then I know we're not going in that direction. We'll probably go in the opposite direction. So is it producible? Is it reducible? So if I can produce it, it's a hypocrite's law, right? I'll not do harm, but I can actually do the opposite. If I can know how to create harm, I know how to help you. One of my biggest mentors was he's basically a karate expert. He traveled the world and beat up everybody. He was, one day he said, I'm going to take this energy negative-wise and make it into positive. And now he's one of the biggest healers in the world. He's my best friend in Ramsey, an acupuncturist. So he's taught me, if you look at somebody, you can read them, you can see where their issues are. You can use that to your advantage to hurt them, or use it to your advantage to help them. And that's what we do. We can actually put you in a position to say, oh, this hurts. I'm going to do the opposite to reduce it. So then we look at the nature of the pain. We already talked about this a little bit. Pain with standing and walking, most likely stenosis. Pain with bending, most likely disc. Pain with sitting, most likely SI joint. Now, when you do have it, when you do get pain, it's in our nature to ignore it, right? You have it. Oh, it's going to go away. I'm not going to go see anybody right now. I'm going to maybe take some over-the-counter medications. I'm going to drink a little water. I'm going to rest a little more. I'm going to do ice. I'm going to do heat. but you typically try to ignore it. So that's the first thing. Number one, biggest mistake sciatica and lower back sufferers make is they ignore it. Now, you can alter it, like I said, ice, heat, over-the-counter medications. But now it's time to handle it. Everyone in this room has said, I'm going to handle this. That's why you're here. You want to handle this. You made the first step. You may have already had therapy before. Might have been good, might have been bad, I don't know. But now you're here to take care of it. And that's important. So that's where we are now with diagnoses. You've made the commitment. As much committed as you are to me with how serious you are, you're going to get, I'm going to commit back to you. If someone comes in here and they're canceling their appointments, or they're not serious about the exercises, or they're goofing off, then my commitment's going to change too. It has to be even, okay? Even Steven. We get really good outcomes. Both Karen is also another therapist here, Dr. Michelle Twill, she gets great results. I get great results. We look for outcomes, and that's what we want to help you with. So, 3 most common causes of back pain, right? Disc, degeneration, disc disease, the same as stenosis, and pelvic problems, which is SI joint. So you guys were streamlining through this. This is great. How do we treat it? European style is physical therapy. So physical therapy is a pretty young profession. We started in late 60s, early 70s. In the European style is what I've trained with and learned from the best. That's why I'm so good at what I do. We're catching up over here. We're starting to do more function. If you've been to therapy in the past and you've seen like straight leg raises and done those sort of things, that's gone. That's out. That's only if you have surgery 2 days post. Now we're getting you to move. We're doing function. We're getting you to squat. We're getting you to lift. Our profession is evolving greatly in a short amount of time. A lot of hands-on. It's important if you go to therapy and they're not getting their hands on you, especially if you have stenosis, don't go. Come here. You need to have hands-on approach. It's important for a lot of things. It's important for emotional too. It's important to get release. A lot of my patients, I say it's almost 80% emotional. Like if I can get you to trust me and I can trust you, you're going to get better. Okay, I'm going to show you everything I got. I'm going to give you everything I got and you get better. So it's important to do hands-on. The idea to stretch versus stabilize, that's my expertise. I can kind of just do my evaluation, say I'm going to stretch this, I'm going to stabilize that. When do I do abdominal exercises? When do I stretch? And that's sort of case by case. On occasion, in an extreme disc issue, I will promote traction. We don't have it here. I tried it with my colleague yesterday manually. I can do that as needed, manual traction. But if it's a pretty severe case, I'll make sure you get the right place to go for that kind of traction. Decompression units are pretty good. You guys heard about that, decompression units?
I tried it.
You tried it? How did it go?
Very good for my insurance. They want to pay for the rest of the classes.
Yeah, insurance stopped paying for decompression, but what most places do, and the place I worked at last, is they use it as a marketing tool to get people in, so it's justified business-wise, and then they can use your physical therapy benefits to pay for it. So, do you have good benefits for physical therapy? Is that the issue? Or?
I guess not, it's not so good. when they
Because most
stop
places
it.
will just waive the decompression because insurance no longer pays for it, and just take the insurance. But we can talk about that. Do you have a disc issue? Is that why you did traction?
I have 5 herniated discs,
Okay.
1 pinched nerve on the herniated disc, and 1 bulging disc.
Right. You have all different levels and layers. Okay. Has anybody worked on your hip flexors in the front, or your hips, or looked at your hamstrings and quads and done a decent evaluation on you?
The last physical therapy that I went to, I liked that. That's the
Okay.
one that had the back decompression,
Oh,
and
good.
they had a lot of stretching and.
But it returned, apparently. Okay. So this is why this is here. You come to me, I relieve your pain, you come for the 8. Within 6 treatments, you better be a 2. If not, I'm going to be upset with myself. Haven't seen that ever. Anybody that's ever seen me in 2 treatments, and the last can tell you they're 50% better. Within 6 treatments, 75% better. That other part is your part. What are you doing at home? Am I educating you enough to do stuff at home? Okay, I do a lot of that. How is your health overall? How are you sleeping? What is your nutrition like? These are all factors. When we talk about the hip flexor in the front, it lays intimately with the stomach. So if you have digestive issues, which I can assess right away when I put my hands on you, I will make sure that we're talking about digestion appropriately. What are you eating? What aren't you eating? What time of days are you eating, this sort of thing? These are all things I troubleshoot. I'm a holistic care practitioner as well. I do acupuncture needles for dry point needling. I do Toi Na, which is a Korean form of hand-foot There's a lot of things I can troubleshoot, and that's when we're getting towards that last 25%. Why didn't this patient get better? Most of them get better just from hands-on, give them some stretches, give them some exercises, and then create a health and fitness plan for the future so that doesn't come back. So maybe they didn't get that last part. Maybe there was something missing in there. I don't know, but we can find out hopefully today and or going forward. Okay, we're cruising. Do I stretch? Do I stabilize? What do I do? That's the expertise. Or do I do traction like we talked about? Why don't we take a little break? If you guys want to get some coffee, I know some people rushed in here. We'll take donuts. You gotta go with cheese. There's no cheese, but you can have donut. Okay, we'll take like a 5-minute break and then think about any questions you may have, and then I'm going to treat somebody so you can kind of get a feel for how I do the hands-on approach. All right?